Today's episode is all about stories, real experience from veterans and advocates who have stepped up to make a difference. These are the voices we don't always hear in the headlines, but they shape how we understand the struggles and victories in the fight for veterans' rights. I'm Dan Rivera Jr., and you're watching Rights Watch. Before we get started, I want to invite you to support our work. Please share this episode, hit like and subscribe so that more people can reach these conversations. Your support helps us keep bringing important voices to the table. Before we get started, I want to invite you, and I want to give a huge thanks, first of all, to Tim Hauser. This is the first of Tim, and just so you know, this is the first episode of a new segment that we're calling Stories. And stories we'll hear directly from people who've lived in these challenges, veterans, unions leaders, advocates who can show us the human side of these issues. So Tim, I'm honored to welcome you as our first guest. Tim Hauser is a Gulf War veteran, founder of the Veterans Assurance Network, and a leading advocate for veterans' rights. Tim, thank you so much for being here today, sir.
Thank you for having me on, Donnie. It's quite an honor for me.
It's an honor for me as well, and thank you so much for your service and everything that you're doing. Not just everything you did, you've done a lot for our country, and you're still keeping up the fight. So thank you very much, sir.
You're welcome.
So to get started, Tim, I just want to start with your journey. You served during the Gulf War,
Yes.
and now you've become a national voice for veterans' rights. Can you share how that path unfolded? What led you into advocacy?
Well, it actually started almost 27 years ago. My brother Dennis, a Vietnam and Gulf War veteran, lost his battle with his demons, and unfortunately, he took his own life on Christmas Eve. It'll be 27 years this coming Christmas Eve. Um, at that time, I noticed that some of the people that I served with, some of the people he served with, also took their own lives, and I thought that that was kind of odd. So I started calling congressmen, senators, anybody that would listen, but I got nowhere. And at that time too, my health was starting to fail me, so I had to stop for a while, take care of myself, and in that journey of my battle with my demons, with my PTSD and other health issues, it took me 25 years to get service connected for a lung disease that I have. And I kept telling the VA that my lung disease was from breathing fumes from burn pits and oil well fires because the Iraqi army set all their oil wells on fire, and we had to breathe those fumes in every day. And when I filed my last appeal, I also included a study that American doctors did concerning increasing cancers and respiratory diseases in Saudi Arabia, especially in the area where I was stationed at, which was Dhahran. And finally, my claim was approved, and my wife and I were so overcome with joy and happiness that finally somebody listened and got my story correct, that we posted it on Facebook, and within an hour, I got a message from a young man, and all his message stated on Facebook was, "Call me," gave his phone number, and this will change your life. So talking with my wife a little bit, she jokingly goes, "What's he gonna do? Stalk you? Give him a call, see what he's up." Because we checked his profile and he seemed okay. So I called, and he said he was part of a group called Burn Pits 360, and they were advocating for the PACT Act in Washington D.C., and they would like me to join the fight. Well, I was on home oxygen, so I could not go at first. Matter of fact, I did my very first Zoom meeting with an elected official from my hospital bed. I was in the hospital for that, and I think that is what got that congressman to vote yes on the PACT Act. Uh, and that congressman was Dave Joyce from
Wow.
Ohio. And so to escalate my journey into this advocacy for this bill, a fireman who had to fight for his benefits from 9/11 because he worked at Ground Zero and became sick from that. He sent me a portable oxygen concentrator overnight, saying, "Dude, we need you in Washington D.C. You got to fight for this bill. You got to tell your story." So that night, my wife told me she had arranged for airplane and hotel room for me, and off to Washington D.C. I went. And when John Stewart found out that I was borrowing this oxygen concentrator so I can go, he talked with Rosie Torres, the head of Burn Pits 360, and they were able to get me a portable oxygen concentrator on my own. So this way I could keep going back and forth to Washington, D.C. Because there were times where they'd call me at 8 o'clock at night saying, "Hey, we need you in Washington, D.C. at 7 a.m. tomorrow morning." So I have to pack up and go. So having my own personal concentrator allowed me to be able to do that because the VA only gives you oxygen tanks. So you
Mhm.
can't travel with oxygen tanks. You can't bring them on airplanes. You can only bring two onto an Amtrak train. And in order to sustain your life on oxygen, I would have had to pack up at least 100 tanks in my car to get me through a few days. They
Right.
only last for like 2.5 hours. Um, so that pretty much sums up how I got started in fighting for my fellow veterans.
Right. And it's such a compelling argument, compelling story, especially. Um, I know mental health is a big issue within the veterans community because of the things that veterans have gone through. Um, so in a way, your story really reflects on the importance of why we need veterans' voices out there to pinpoint these issues that were being overlooked. And I want to get into the PACT Act in a few moments. But for those of those listeners, can you tell us what the Veterans Insurance Network does for veterans, um, and what kind of services the Veterans Network Insurance does for veterans?
Well, the reason we started Veterans Insurance Network was while I was in Washington, D.C. After the Senate voted the bill down and we started sleeping on the steps of the Capitol building to raise awareness of what was going on. Veterans from all across the country were coming in support. And one veteran sticks out. He was a Vietnam veteran, lost his arm, lost his leg. His leg prosthesis was broken, so he's hobbling around using a old uh, crutch held together with duct tape so he could walk on that leg prosthesis. So he went to a major nonprofit that was there advocating with us and asked them if they could help him. And they said no, that they only help post 9/11 veterans only. Now, don't get me wrong, folks. You, I can understand, can't help everybody. So they limited their area of help. And that's not what got me upset. But what got me upset was they did not offer this veteran information on where he could go to get help. So by seeing that, and that happened to another veteran as well with another nonprofit while there in DC, um, we saw it necessary to have a legit network of nonprofits that cover all spectrums of services and aid to come together and say, hey, if we don't have the resources or this isn't where we specialize our help in, we know who does, and we will get in contact with those people on behalf of the veteran and follow that veteran through their journey with that organization to make sure they're getting the help that they need. So that's one aspect of what we do is we're forming that network. Two is I want to pay it forward with the oxygen concentrators, and we want to provide veterans across the country that are on home oxygen that lost their mobility due to being on oxygen. We want to get them a portable oxygen concentrator so they can get that mobility back, which, by the way, when you are on home oxygen, you can't travel anywhere. I mean, going to the grocery store with an oxygen tank, you're unlimited time. So depression sets in. This will help eliminate a lot of the depression that veterans that are on home oxygen go through because they lose their mobility. And two, we also advocate for veteran suicide prevention. We got a law passed here in Ohio last year that designates September 22nd as Veteran Suicide Awareness and Prevention Day. And we are working to get this day recognized nationally. And we are working with Congressman Self from, I believe he's from Texas. He has a bill in Congress now that will designate September 22nd as Veteran Suicide Awareness and Prevention Day nationally. And what we do here in Ohio with this day is we bring in organizations, not necessarily veteran related, but like American Foundation Suicide Prevention will come to our events. NAMI will come to our events. Anybody with a mental health aspect to their organization is more than welcome to come join our event on September 21st. It's called Rally Against Suicide. This is our third year holding this event. First year in observance of September 22nd. So we've got all these different organizations coming in saying, hey, come not come learn how you can help somebody that's in crisis. So we are advocating for people to come to learn about warning signs, learn suicide prevention, and not just that, but learn what resources are available for those that are in crisis. You see, there's this law that's out there for veterans that are suicidal, where they can go to any ER in the country and say, "Hey, I'm thinking of killing myself." Upon admission into the hospital, the VA, regardless if the veteran's enrolled in the VA or not, the VA will pay for 30 days in hospital, inpatient care, 90 days outpatient care for that veteran. When I read about that, just I just learned about that law last year. It's actually been in effect since January 17th of 2023. Nobody knows about it. So this is one of the reasons why we're holding these events. These are the resources available to help your individual that's in crisis. Now, Veteran Insurance Network, of course, is going to dedicate its resources towards veterans, but like Foundation of Suicide Prevention, NAMI, they're non-veteran related, so they help everybody. And then with the LGBTQ community losing their crisis line, those people need to hear a voice saying, hey, come here, we can help you. And you've got to admit, Danny, there are several, actually more than several, veterans that are part of that community as well. So we want to, so not only is this directed towards veterans, but the entire community. And what better way to get a veteran to seek help for mental illness than to have the community come and say, hey, we're standing behind you. We've got your back. Come on, let's go get you help. The veteran's not going to seek help on their own. They
Right.
need some prodding. They need somebody to say, "Hey, look, here's what we can do for you. Please come accept what we offer." And that's what September 22nd here in Ohio is all about, bringing the community together to help each other.
Right. There's a lot of, I know in my own experience, I work with veterans all the time. It's part of my work. And I know that one of the biggest struggles for veterans that I've seen is access to information. Like a lot of veterans don't know, like you said, that they just don't know what's out there. They don't know that they're eligible for certain benefits. They don't even know that they're a lot of veterans don't even come to the VA until they're like in a very advanced age, and they basically come because they didn't know that they could have had access to all these benefits years and years ago.
Right.
It's hard to get um, the voice out, especially because there's not many resources out there that really help veterans understand this. So, thank you so much for being one of those voices, Tim, and directing veterans and helping them understand what the things that they can get access to through the VA. I know, as part of the VA, it's been part of my job as well to try to educate these people, but
Hmm.
it's hard whenever you're limited to a confined space. So that's when uh, events like this event that you're organizing um, comes into place. Like we need people to come out here. We need people to understand what their benefits are. We need to minimize we need to maximize suicide prevention and minimize suicide in our population of veterans. So, and now I want to talk a little bit more about the PACT Act, Tim, because I know that you've done a lot of work around toxic exposure. This act recognizes veterans who were exposed to toxins like burn pits, Agent Orange, and adds a lot of conditions to that are automatically presumed to be service connected. I
Yes.
remember working. I remember working, Tim, in the VA clinics during that time and seeing the push to screen veterans for exposure. And so many didn't realize that they might qualify for new care. They didn't know that what the conditions that they have were because of a certain exposure that didn't come that wasn't really advertised, or they weren't told that condition particularly was because of that exposure. Now, Tim, as an advocate in this area, can you help our audience understand what the PACT does really is? Why was the PACT Act such a historic step, and how does it actually play out for veterans on the ground?
Well, for veterans such as myself who were exposed to toxins uh, during while stationed in a combat zone, uh, we were exposed to a lot of different lifelong lasting chemicals that we were never even told about. Uh, I know with the burn pit that was near me, they threw in uh, unused ammunition. That unused ammunition was made out of depleted uranium. When depleted uranium heats up to a certain degree, to a certain temperature, it becomes active again. One of the toxins that I was tested for was uranium, and I tested positive. So that it definitely came from being next to that burn pit, because we knew years later that once you heat up depleted uranium, it's active again. So I was exposed to, radioactive material. Another one that's permanently in my body is benzene. That comes from burning all different types of uh, treated woods, plastics, uh, metals, and believe it or not, fossil fuels. Benzene's in fossil fuels. And what is oil? Oil is a fossil fuel. Iraqis set their oil wells on fire. We had to breathe that every day. So this bill was designed to help veterans get the health care for their toxic injuries that the VA was denying us. I was one of the very first ones to get a claim approved for toxic exposure prior to the bill being uh, signed into law. But there were not just thousands, but millions of veterans that were suffering from all types of cancers, respiratory diseases, blood diseases, uh, gastrointestinal diseases that the VA says we just cannot connect these to what you were exposed to. So, with a little bit more study, we were able to start swinging then VA Secretary Dennis McDonough into saying, yeah, okay, you are starting to prove this, that I am wrong on this. So we do need you to get this bill passed because I can go ahead and state today that, yes, we're going to start approving claims for this, for these toxic injuries. So that's what it is. It's even though it's cancer or it's a lung disease, it's still an injury because it was caused by something else. And it was caused due to our involvement in a war situation. So Dennis McDonough stated, let's get this bill passed because once I'm no longer VA secretary, the law will still be there. So the next VA secretary has to follow the law. He would not be able to take these benefits away. So that's why it was historic. It it helped veterans from Vietnam that were exposed to Agent Orange. Now, Agent Orange is the broad term used, but there were so many different pesticides and herbicides that the government used during Vietnam. They had Agent Red, they had Agent Blue, they had Agent Green, they had Agent Yellow, and Agent Orange. So they just made sure in the bill that Agent Orange was a broad term covering all herbicides and pesticides that the government used during Vietnam. They finally got benefits for those that were stationed in Laos, Cambodia, Guam, Thailand, and Taiwan. Before it was only if they were in country in Vietnam, could those veterans reserve uh, get any Vietnam or VA benefits. They had to be in Vietnam itself and for a certain period of time. This bill expanded to those other countries that we had veterans in, that we had service members in, such as, Laos and Cambodia, which our government denied for decades. Those men and women were finally able to get into the VA and get the health care that they needed, even though I feel it was way too late. As a matter of fact, I did a resource fair. It was the Summit County Veteran Stand Down in Ohio yesterday. And there must have been, I think it was about 10 Vietnam veterans that never even heard of the PACT Act. 10 Vietnam veterans who still have not heard about the PACT Act. Trust me, they got a quick lesson on what the PACT Act was. The VA was there to help with claims and benefits, got them over to those tables and got their process started. But like you said, information is not getting to veterans. If 10 Vietnam veterans still did not know about the PACT Act, that means information is not getting spread correctly.
Right, and that really is one of the biggest challenges I think about this whole situation is um, we need to find ways to get the word out to our veterans. And I know that in the past it's been, and I think even still today, the topic of service connection it's a hard one because to get our veterans the care that they deserve, sometimes it feels like they really have to prove themselves and they really have to prove why it is that they are deserving of service connection. And, and at a personal level, I think that it's really unfair to a lot of our veterans that really deserve care and that have been given the runaround on having to prove themselves. And
Right.
a lot of times it's really unfair because they don't have access to the records that they are required to submit to demonstrate that they're deserving of the service connection.
See, this is another reason why this bill was so historic. The first time in history that a bill for veterans health care gave presumptives.
Hmm.
So if you served in a certain area and you have any one of many of these diseases on this list, it is presumed you got it while you served in that area. So your claim is now going to be approved. You no longer have to prove your illness was from your service. Your service proved that you got this illness because of where you served at. That's why this bill is so historic. It took the blame, the not the blame, but um
The
burden,
process.
the
Yeah.
burden of proof away from the
Hmm.
veteran that they no longer had to, like me. That's why it took me 25 years to get my service connection. If it wasn't for me discovering that health report from, I think it was from the World Health Organization, written by American doctors on the rise of cancers and pulmonary diseases in the city where I was stationed, I don't think I would have gotten my um, claim approved until the PACT Act was passed. But with me being able to get it approved prior to that is what got me back into my advocacy work.
Right.
But but yeah, it matter of fact, a couple of those Vietnam veterans that I talked to yesterday says, no, they'll just disapprove. And I says, no, you served here. You have this illness. You just told me you do. Let's get you over here. They have to approve your claim. And once I showed them that in the literature that I had on the PACT Act, finally they said, okay, let's go get this claim filed. And thank God they did because they deserved it. They deserved it decades ago.
Right. It's that you hit it right in the nail. That's why it's so historic. It's practically that burden of proof. It was so hard. It was so big, and it
Hmm.
was really unfair for a lot of veterans. And I'm so glad that the PACT Act was put into place to help these veterans get this care that they deserve. And I think it plays an important part of why the VA is so important for our veterans as well. And I want to get to the VA in a second, Tim. I'm just going to make a quick pause here, and when we get back, we're going to talk about the VA.
Okay.
Attention to all union leaders, labor defenders, and businesses of all kind. Do you ever struggle to stay connected with your members? Have trouble keeping track of your cases? Or just feel overwhelmed trying to juggle files, deadlines, and communication all at once? Trust me, I've been there. That's exactly why I created Riversites. Riversites wasn't built in a boardroom. It was built from my own experiences and needs. I got tired of tools that didn't actually work or platforms that look outdated, hard to navigate, don't have all the tools I needed, and somehow were outrageously expensive. So I decided to create something better. Riversites gives you a professional, modern website. But more importantly, it gives you the tools to actually run your office. It's customizable, it looks great, and you're never left on your own. You get real one-on-one support every step of the way. But Riversites goes far beyond just a website. You can track all your cases in one place, auto-assign case numbers, follow timelines without missing a beat, store your files securely, use built-in appointment scheduling, and even host your meetings all from one easy-to-use system. Best part, It's extremely affordable. How do I know? Because I built this platform from my own experience, and I made sure every union could afford the tools they need to run their office the way your members deserve, because your members deserve the best, and so do you. And here's the thing. Riverside isn't just for unions. We built websites for any business, big or small. Whether you're a shop owner, a nonprofit, a service provider, or a community leader, we've got your back. As a way to support the cause, we're offering an extra 10% off any multi-year plan when you use the code Fight for Rights. Just go to our website at riversidehub.com/Fight for Rights and schedule your free consultation today. That is again, riversidehub.com/Fight for Rights. Let's build something powerful together.
So, Tim, going back, we were talking about the PACT Act and how important it is for our veterans, taking away that burden of proof of why it is that they should get service connection in relation to their to the things that they were exposed to and what their conditions are in relations to that. Now, I want to go into a little bit further into the VA. I think that without the VA, I think the VA is essential for our veterans, Tim, because it's where veterans, it's the place where veterans go to get care. Mm-hmm. It is the healthcare place for veterans. I think if there's one thing that we owe our veterans, for the price that they've done, that they've paid, the sacrifice that they've made for our country, I think if there's at least the thing that we owe to our veterans, it's healthcare. It's access to healthcare. So from your advocacy work, what do you think are the most pressing needs within the VA right now?
The most pressing needs right now is a safe and positive, supporting work atmosphere for the employees. The reason I bring that up is since the election, actually since the new VA Secretary Doug Collins was confirmed, there's been a lot of talk about reducing the workforce, cutting jobs. And in his pursuit of that, he's created an atmosphere that it's hard for employees to work in. Instead of backing his employees, he backed Doge in stating that his employees had to submit an email every week with 5 points of what they did the week before. For some of those individuals, it's hard to give 5 points because one, they check us in for appointments and they check us out. Some nurses, all they do all day is check our vitals as we get checked in, see our doctor. Same job over and over and over again. Well, it's a very important job. So they had to prove that they sent that email in every week to their supervisor. So the supervisor went around saying, show me that email, show me that email. Now that a certain individual is no longer part of Doge and is no longer working for the government, that email has changed from 5 points of what they did the week before to how can we save the VA money today? And they have to submit that every week. And on top of that, the VA created what they call anti-Christian bias task force. So if an employee sees anything that is not Christian-based happening in the VA, they are to report it. And if they don't report it, they can be terminated. So what is anti-Christian bias? So who knows? He won't come out and state exactly what they're supposed to do. Because if you walk into any hospital in the VA, there's a chapel. That chapel is set up for every single denomination of Christianity. No place for Muslims, no place for Hindus, no place for Buddhists. It's all Christian based. So what are they getting at with this? What it's doing is it's creating an atmosphere where the employee now has to look over their shoulder and take away their attention from the veteran. Well, me giving this vaccine to this veteran, is this anti-Christian bias? Is somebody watching me do this? Me offering information about the women's clinic to this woman veteran who is pregnant but also suffered severe sexual trauma while in the military. Is that anti-Christian bias? You know, he
I think
fired
there's a lot
the
of what ifs, and
yeah,
with this certain, like with the anti-Christian bias, that I'm as a Christian myself, I do have to say it makes me a little uncomfortable, just because of the fact that it's not well defined. So right now, I do believe in the freedom of speech, liberty of speech. I do believe in liberty and freedom of religion. I do have the point of view that God gave us the right to either want to choose Christianity or not, and God has given us the option to either follow Him, or we have a right to do that. So I have the point of view where I should not, I can preach my values to others. I cannot impose them and towards to others. And what I hear you say is that this is all creating a hostile work environment within the workplace, because now everybody has to look over their shoulders, making sure that whatever they're doing, it will not be considered anti-Christian.
right.
And I certainly understand that point of view, and I do believe that we have the right to either want to be Christians or not. And it shouldn't be reflected on our policies. Our policies shouldn't be based on that, because we're seeing an administration who's just going after a certain group of people. And if you do not follow and you do not fall within this category of people, and you don't look a certain way, you don't talk a certain way, you don't believe a certain way, then you're no longer welcome. And it's very disheartening as a VA employee to see this happen within the workplace that I work at.
When I walk into the VA for my doctor's appointment, I don't want to see all the nurses and all the doctors looking the same or have the same beliefs. What I'm looking for is a doctor or a nurse who's going to uphold the oath that they took when they graduated from school, saying that they're going to do whatever they can to provide the best health care that they can. That's what I'm looking for. I could care less if they're a Christian or not. If they uphold their oath that they took, that's what I want. That's what I'm looking for. That's what every single veteran should be looking for, is that doctor and nurse who took that oath and is upholding that oath and is following that oath to the T.
At the end of the day, it's about the quality of care that we offer
Yes.
veterans. If somebody wants, if we want people to follow God, then let's invite them to the church. Come to our church.
Exactly. There's a
But
chapel. There's a chapel down on the first floor of every single VA hospital. There's where they can go.
right, and
But when I'm in their office seeking health care, I don't want to know about their religion. I want to know how they're going to take care of me.
right, and I've had I've had veterans who have had spiritual concerns, spiritual needs, And I've never, Tim, imposed my own beliefs into our veterans, but I've been able to, those who ask for it, I'm able to help them in some sort of way, and spiritually, where they're grateful for it, and don't feel that I'm
Mhm.
imposing my views onto them. But when veterans come to the VA, they need, the bottom line is that they're looking for quality care.
Right.
And this administration is doing everything they can in their power to deviate from that, so that it becomes ineffective in a way.
I'm going to give you some examples here that I hope changes a lot of veterans' views on what's happening at the VA and join in speaking out against what they're doing. In 2019, the VA had the longest wait times in recent VA memory. And when I talk about wait times, it's not sitting in the waiting room waiting to see the doctor that day.
Mhm.
It's from the time you make the appointment to where they can actually schedule you to come see the doctor. Back in 2019, it was taking months to be able to get in to see even just your primary care doctor, even longer to see a specialty doctor, and then almost a year to see a mental health provider. Over the next administration, not only did they get wait times down, but they got the VA wait times below the national average of all hospital systems in this country. And Secretary Doug Collins is saying that he wants to improve on wait times. You're not going to get much better than 2-3 days for to get in to see a primary care doctor. Now, granted, some hospitals in the VA system need work to improve on their wait times. Not every hospital is up to snuff, but that's every single hospital system in this country. The Cleveland Clinic, I finally got approved for community care to go see a pulmonary specialist at the Cleveland Clinic. From the day I called to the day they said they could schedule me was 6 months. Now, I called this morning to set an appointment at my VA hospital, which I'm gonna brag about. It's Lewis Stokes in Cleveland, Ohio. That's the hospital I use the most. I also use the clinic in Akron, Ohio, for my primary care and my mental health care. Um, I called this morning and they're getting me in next week to see my pulmonologist. It's less than 7 days. You're not going to improve much on that. So, plus, he's talking about cutting the workforce back to 2019 levels. One thing he's not telling the public is there are 1 million more veterans enrolled in the VA system today than there was back in 2019. And even in 2019, Trump's administration was stating that they were extremely short staffed, even though they put a hiring freeze on.
And that just shows how, that there's a whole agenda behind all of this. But when you say that you want to improve wait times, and then you go ahead and start cutting staff back to pre COVID 19 levels, where we were already short, you're going to make wait times longer than they have ever been, and access to healthcare will be even harder to get, because you're not going to have the sufficient staff to support the workload that we already have. So yeah, it's a big issue.
Recently, I think it was like 2 months ago, Secretary Doug Collins was in front of the Senate Veterans Affairs Committee answering questions. And one senator stuck out to me, and that was Senator Bernie Sanders. Now, Senator Sanders has been fighting to get free dental care for all veterans, not just those of us that are 100% service connected, but he thinks the VA should supply dental care for all veterans, which I agree with him. Dental care, I think, is the most essential healthcare issue there is. If you don't take care of your teeth, the rest of your body falls apart. But point I'm getting at is Bernie Sanders told the secretary that he saw that he had sent in some figures on staffing, current staffing at the VA. Now, remember, this is from about 2 months ago. Bernie Sanders said, so Secretary Collins, you're stating that you are 6,600 nurses short-staffed. Secretary Collins agreed. You are 2,600 doctors short-staffed. Secretary Collins agreed. He says, you didn't give a number on this, but you say you are critically short-staffed in social workers and those that provide counseling in mental health. And he says, yes, we are critically understaffed. Bernie Sanders asked him, so in your personal opinion, do you feel that these shortages are hurting veterans from receiving quality and timely health care? Secretary Collins says, yes, it is. This shortage of staffing is very critical and it is hurting veterans. And then Bernie Sanders says, then why in the hell are you trying to fire 83,000 employees for?
Mm-hmm.
Secretary Collins really didn't have an answer, except that streamlining the VA will improve wait times. And that's when Bernie Sanders says, wait times, you've got the best wait times in the nation right now. Matter of fact, your Cleveland VA hospital in Cleveland, Ohio, is rated the best hospital in the country. So what are you complaining about? Why aren't you fixing where you need to fix? Why are you dismantling this entire system when you got areas that need fixing and areas that don't? You got the best hospital in the country, but yet you're dismantling it by cutting your workforce. What a lot of people don't understand is when the PACT Act first came out, a lot of the research for toxic exposed injuries was done at Cleveland VA. A lot of your research in historic, in innovative prosthetics research was done at the Cleveland VA hospital. A lot of your mental health therapy research for PTSD was done at the Cleveland VA hospital. It was one of the leading research hospitals in this country. With cutbacks and budget cuts and everything else, that research has stopped. So he's dismantling the best hospital in the country. He's actually dismantling the best healthcare system in the country.
And that leads to the question: do they even care about veterans' healthcare? At the end of the day, why would you want to dismantle all of these services? Why do you want to dismantle the leading hospital system for research for veterans care? I mean, why would they do this?
I just got one theory on that, and it's my theory. But one thing I can't believe is Secretary Collins himself is a veteran. The first veteran to run the VA. I was kind of happy about that at first, but now, and here comes my theory. He's nothing but a yes man for Donald Trump. Donald Trump tried to get rid of the VA in his first term. Was not successful. Now that he's got other people behind him on this, and he finally got somebody in there that will answer to him and him only, he's going to be able to get rid of the VA. So all that hard work that so many people put in getting the PACT Act passed and getting the Compact Act passed, which is saving lives, keeping veterans from committing suicide, and other laws that benefit veterans, all that works for nothing unless veterans stand up and fight for the VA, saying, stop dismantling it, stop destroying it, stop trying to either privatize it or close it down altogether. They need to, I'm calling upon my fellow brothers and sisters in the veterans community. Matter of fact, all Americans. What's happening at the VA is happening behind all this other stuff that's going on, so you don't notice what's happening. If you're a veteran that utilizes the VA, talk to the employees. See how they feel. See if they'll open up to you. See, I've run rallies at VA facilities in the state of Ohio in support of VA employees, so they open up to me. They say, Tim, this is what's going on this week. Tim, this is what they're telling us is going to happen now. So one thing that a lot of people don't realize, hey, are you waiting on a claim to get approved? Are you waiting to get your service connection fiscal done? They stopped those. They stopped scheduling fiscals for claims. So what happens now?
Yeah,
And I got that from people who worked in the claims department, who actually
Mhm.
process claims and approve or disapprove claims. One of the steps that they're supposed to take is schedule physicals to determine the percentage of service connection. They stopped those physicals. So is everybody going to be 100% or is everybody going to be 0%? Or are you just not going to process claims now? What's the next step there, Secretary Collins?
Right. There's certainly a lot of debate over all of these policies, and certainly Secretary Collins is I want to say the reasons behind why he's doing all of this. And you know, this is my personal opinion. It's not in the best interest of our veterans. It's really not. It's sad to see a veteran who doesn't have the best interest of our veterans at heart. You know, as a VA employee, we have an acronym that says I care. That's the acronym we use at the VA. I care. But really, you know, it's so hypercritical that the person that's running the VA doesn't care, right? And that's it's so sad. It's so sad. You would think that a person in that position would want the best for veterans. Instead, they just want to follow
himself.
Right.
That's
right.
what's killing me is he's a veteran himself.
Right. It's really unbelievable to think that a veteran and like you said, the first veteran that's running, you know, as secretary of the VA is the one that may end up destroying the VA, you know. And then so, you know, all of these policies, all of these changes, the loss of bargaining rights for VA employees. Tim, I work. I'm a representative for AFG as well, and all of these things that we've lost right now and that are in the line, they're all being pushed as something that's positive. Whenever they announce, for example, that they're doing away with the contract between the VA and AFG, they said, "Oh, this is something great. Now veterans are gonna be able to get the care they deserve. Now employees are gonna be able to get promoted. Now we're gonna be able." And really, these are all just things, excuses that they're making up. They've placed and they posed issues that are really not issues. They've posed them in a positive light, and what they're doing is they're confusing people. They're making people think that what they're doing is positive for the VA. And at the end, you know, if we don't fight, if we don't stand up, if we don't raise our voices against all of this, the VA may end up being destroyed. We may end up not being able to render services for VA because there's, the end goal here is privatization. They want to do away with the VA. The main, I do not think as a VA employee, it's not because I work in the VA, it's because I know the specific needs for veterans. I know that the private sector, you know, that right now, try to go to an ER anywhere. You're not going to be able to sit as it is as a civilian. Just imagine as a veteran, our hospital systems are just gonna start being even more overwhelmed because you're gonna transfer all of this care to the private sector, and they're not gonna do the job as well as we do. They don't understand the needs of our veterans as well as we do. And Tim, as a veteran yourself, I just want you to explain to us: do you think that the VA is an essential part of our government, that the services that the VA offer is essential?
Yes. Oh my God, yes. What other hospitals set up to handle veterans with PTSD? What other hospitals set up to deal with the trauma that somebody who was wounded in a combat situation, when they have to go in and get more surgery done to fix the injuries that they received while in war? The VA provides specialized care for veterans. Let me say that again. The VA provides specialty care for veterans. It's not a collect-all like other hospitals. The VA is set up to handle veterans issues, just veterans issues. Example, years ago, women were not allowed into the VA because they played a very minority role in the military. So you didn't have gynecologists, you didn't have prenatal care, you didn't have. Matter of fact, the VA delivered its first baby in 2018. But what it did back in during Vietnam is it provided specialty care. It took what the doctors were able to do in that field hospital in Vietnam and transfer it over to stateside, like Walter Reed. We can continue the care that you receive there, and we can specialize it here. We, like I said, all the innovative prosthesis research was done in the VA. Why? Because more veterans lead this nation in amputations. There's more veterans that are amputees than in the civilian world. Who better than to do the research to help that veteran than the veteran specialized medical system? And it's if you take the VA away and you put all this veterans into this civilian sector, these hospitals are not set up for that. They're most civilian hospitals don't have a prosthesis department. They outsource that to a private company. That private company may have like 4 employees. You throw in veterans, that private company now is not going to be able to handle the burst of patients that you're going to see. Nor are they going to be able to supply the type of prosthesis that the VA supplies. So PTSD, mental health. Doctors are not getting the special education that they need to handle what a veteran goes through in wartime. See, this is my theory. Um, when a veteran goes off to war and then they come home, a piece of them, I'm going to say part of their soul, just to say, is left on the battlefield, regardless if they were injured or not. That's left over in the combat zone. When they come home, there's a void in their soul, and that gets filled up with anger, despair, distrust, stress, envy, guilt. All that's rolled up to fill in that void. And at any given time, that void can burst open, and then you have a crisis on your hands. Mental health providers in the civilian world are not set up for that. They don't get the education to handle something like that. So we need the VA, and this is why I'm asking all my brothers and sisters to stand up with me and tell them they need to keep their grimy hands off our VA. Is there problems at the VA? Yes, at certain hospitals there are. Can it be fixed? Yes, it can be fixed, but it's not by what one man says. We, the veterans, need to speak up and say, this is what's wrong at my hospital. This is what's wrong at my clinic. This is what I think is the way we need to fix it. And Secretary Collins needs to listen to us veterans. We're the ones that are utilizing the VA. He doesn't. He gets free health care for the rest of his life because he was a congressman. He's never stepped foot in a VA to get health care. He's only stepped into a VA for a photo op. And that's all he does when he goes to visit a VA clinic is he gets his picture taken and he leaves. So yes, my brothers and sisters out there, we need to stand together and we need to tell them, listen to us. It's our VA. It does not belong to Secretary Collins. It does not belong to the Trump administration. It belongs to us. It was designed to help us, and the only way it can help us is if we help it. And they need to listen to us. And Danny, I need to give a shout out to AFGE because from the very first rally that I organized at a VA facility, AFGE showed up and we've joined forces ever since. And what a lot of people don't understand, one, the VA is not free when you first enter. You have to reach a certain level of service connected percentage before the VA becomes free. Otherwise, your insurance or your own pocket wallet pays for your health care at the VA. A lot of people who never in the military don't understand that. I know you do, but the VA is not free until you reach a certain level of service connection. We have to pay for it. Two, um, what people don't understand too is once a veteran is service connected, that the VA is was designed to not only take care of the veteran but take care of their family as well. I don't know the quote offhand, but Abe Lincoln stated great to honor the serviceman and their spouse and their orphans. And I believe he is the father of the VA. And I think, and last, last was it, yeah, no, last year when they signed the continuous resolution to keep the government open, there was an amendment attached to that a Republican submitted because the VA's motto used to be the quote that Abraham Lincoln made about taking care of a serviceman, his spouse, and his orphan. That used to be the VA model. That amendment removed that model. And a lot of veterans believed in that motto, and so did a lot of healthcare providers. So, to Secretary Collins, you're a veteran. What the hell you doing? Why are you trying to divide a community that used to have each other's back? Knock it off, man. Because I guarantee you, all you're doing is pissing off a lot more veterans. A lot more veterans are going to start speaking up, and you're going to have to listen to it. And another shout out too is to Dropkick Murphys. Dudes, keep playing your music, and thank you for all your support.
Thank you so much for Tim, for everything that you're doing. Really, you're doing so much important work, and I think you've sent a clear message not only to our veterans, to our listeners, but to the people that are in charge. Secretary Collins, he needs to understand this is a message coming from our veterans. This is your voice represents not only your voice, but it represents thousands of veterans out there that don't have the strength, don't have the platform to be able to bring out these concerns. And you're certainly that voice, that platform for thousands and thousands of veterans out there that desperately need our government to listen. Stop acting and start listening to what our veterans need, so you can actually make policies that work for the veterans, not for the bottom line. So, Tim, again, thank you so much for your work, your contribution, everything that you've done. Thank you so much for your service. If anybody needs to get a hold of you, where can they reach you? Where they can listen to? I know that you have a podcast. Where they can they listen to that as well?
Yes, my podcast is called Veterans Central. You can watch the video on YouTube. Just search Veterans Central. You can also listen to it on Apple, um, Spotify, and I think Amazon, and on Amazon. And one last word. A lot of the VA employees are veterans themselves. So, folks, keep the faith. Please don't quit. We're fighting for you. We need you.
Tim, thank you again. Thanks for
Thank you,
sharing your
Danny.
story, and thank you for everything that you're doing, brother.
Thank you, Danny.
And thank you all for watching today's video. This message, this video, this conversation I've had today with Tim is a reminder that behind every policy, every law, everything that they're doing right now, there are real people, real families, real struggles. And that's what Stories is all about here on Rights Watch, giving our veterans and advocates a space to share their experiences so that together we can learn, we can push for change, and make sure no one gets left behind. So if you're a veteran, a family member, someone with a story you want to tell, we want to hear from you. So reach out, because your voice matters. As always, please make sure to share this episode with a friend. Hit like and subscribe so you don't miss future conversations. Every share and subscription helps us amplify these voices and build a stronger community. All right. Well, thank you all again for joining us today. Stay safe, and remember, we are not giving up.